Hello, and welcome to Let's Talk Climate, a webcast series from ecoAmerica. Today, we are bringing you a very special episode, Engaging the Health Sector in Climate Action. I'm Rebecca Rehr, Director of the Climate for Health program at ecoAmerica. Here with me, virtually, is Dr. Jerome Paulson, Professor Emeritus of Pediatrics and of Environmental and Occupational Health at George Washington University. Hi, Jerry.
Hello, Rebecca. Hello, Gloria.
And Gloria Barrera, a certified school nurse at a public high school outside of Chicago and adjunct professor of nursing at DePaul, Capella, and St. Xavier Universities. Welcome, Gloria.
Hello, Rebecca. Thank you for having us.
We were inspired to have this discussion today by way of the U.S. call to action on climate health and equity. The call to action lists 10 priority actions, one of which is engage the health sector voice in the call for climate action. Our listeners can learn more and sign on at climatehealthaction.org. To start the conversation, I wanted to start at the very beginning. Why is it important for health professionals to speak out about climate change? Jerry, why don't you kick us off?
I think the most important thing to recognize is that climate change impacts the health of every human being on the face of the earth. And as healthcare professionals, if our goal is to protect the health of human beings, then we need to engage about the topic of climate change. We need to talk about how it impacts on health and how climate solutions can be health solutions.
And Gloria?
I would echo the same. As the most trusted profession in the country, nurses are in a unique position to amplify their voices and take direct action on climate change.
Yeah, and that's just true year over year. Health professionals, and in particular nurses, are thought of as the most ethical and trustworthy profession. So definitely polls would back that up and stress the importance. A lot of times when people talk about climate and health policy, they think of the federal government. But I also wanted to talk about why it's important to be engaged at the state level as well. And Gloria, why don't you take this one first?
Sure. I think our understanding of healthy environments being vital to optimal health is examined very early on in our academic careers as nurses. So from my practice as a school nurse to testifying in Washington, D.C., I've made it a priority to advocate on behalf of our most vulnerable populations. And that's both locally at the state level and, as I mentioned, in D.C. So being an active member of ANI and a nurse climate champion, I just see that this is, I think, the most impact that we can make is just being engaged with health policy.
I think that when people think about policy, they generally think about the federal government. But it's important to recognize that there are a lot of climate and health-related policies that are not the province of the federal government. These are policy actions that are taken at a state level, and therefore health professionals need to engage their state government. They need to bring the message that climate change is a health problem and that climate solutions are health solutions. So, for example, if people think about utilities, the electric companies, they're regulated by the states by and large. They're not regulated by the federal government. So if you want the utility in your state to have a renewable standard, how much electricity they have to provide that's generated by renewables, then you're going to have to do something at the state government level, often not even with the state legislature, but an agency of the state government. And that's where the nexus of power is, and that's where we've got to be advocates.
Yeah, I really appreciate that. And I think, some of our listeners may know, and anyone who's taken the Climate for Health Ambassadors training knows this, but I actually was a state level lobbyist in Maryland. So I have an MPH, and I worked very intently at the state level to make sure that there are environmental and health policy, environmental policies that protect human health. And when I brought in health professionals to talk, so I was my day-to-day job, so people expected me to be there and kind of knew what I was going to say after a couple of years. But when I brought working health professionals, people who took time out of their day from working at the hospital or a clinic, or in schools doing healthcare, it meant a tremendous amount and really broke through the noise of the policy making process, of the sausage making process. And so it really makes a tremendous impact when health professionals speak out at the state level in particular, I think.
And there are now in about a dozen states and counting, organizations that generally, but not universally, go by the name of Clinicians for Climate Action. So it's Virginia Clinicians for Climate Action, Florida, et cetera, et cetera. And these organizations exist to bring the message of nurses, respiratory therapists, pharmacists, physicians to the state legislature. In Virginia, we have an annual advocacy day where this year 30 health professionals went to Richmond to talk to members of the legislature and their staff about climate-related health issues.
And Gloria, you mentioned going to DC. What issue were you working on when you were in DC?
That was for regulation on methane emissions. And I did want to also add to Dr. Paulson's statement is that you don't work alone. So anybody listening that maybe they don't know where to start, just know that there are many organizations that are ready to support you on your mission to act on climate change. For example, the Illinois Public Health Association is one that I work a lot with and collaborate with, just on doing statements and knowing what to be advocating for, because a lot of times if you're not on the Hill, then you're not going to know what's open for public comment.
Yeah, and much appreciated that you both mentioned not only advocating for new policies, but commenting on regulation so that we can make sure that there's equitable enforcement across agencies as well and in communities. So definitely brought up a bunch of great points, and I hope that listeners are inspired and maybe toggling over to another window right now to see what's open for public comment in the Federal Register. So we've talked just now about how important it is for health professionals to talk to the public, to talk to policymakers, but I'm really curious about your elevator pitch for your colleagues. Perhaps there are folks you work with who maybe are interested in climate action but haven't gotten engaged, or maybe not as far along on that spectrum. So I'm wondering from each of you, how do you talk to your colleagues about the first step for getting engaged and for taking steps on climate action? And so Jerry, why don't we start with you?
Well, I think in reality, you've heard part of my elevator speech already. Climate impacts on the health of every human being on the face of the earth. But then I think there are, in my world as a pediatrician, specific examples that we can bring. One of the best examples, particularly now as we're in the summer, athletes, the high school athletes who are in practice for fall sports, at least in typical years. Who knows what's going on this year with COVID? But at least in typical years, maybe doing 2 practices a day in this hot weather. And if they're not aware, if their coaches are not aware, if their physicians and other healthcare professionals are not aware, there have been a number of children every year who become quite ill, oftentimes risking losing a lot of renal function, a lot of muscle mass, and things like that. And unfortunately, we do have children and young adults die every year from heat stroke. So to bring in examples from the real world that a pediatric clinician can relate to, and then let them know about the opportunities through ecoAmerica, through the Medical Society Consortium, if they're pediatricians, through the AAP or AAFP if they're a family doctor, other health professions organizations. And so there are a lot of places where they can hook up, connect, feel at home because it's their colleagues who are doing this work.
Yep. And Gloria, your elevator pitch to your colleagues.
So as a nursing professor, I am committed to helping future nurses just understand their role that we each have in addressing critical issues related to the environment and climate change. So I do stress that a healthy environment is vital to optimal health, and use my experience as a school nurse in advocacy to bring the research to life in many of my courses, including policy and ethics, legal issues in nursing, just to name a few. So I think my elevator pitch would be structured depending on who's in the elevator with me, right? I think it would start with just saying what I already mentioned. So as the most trusted profession in the US for 18 years in a row, we nurses are in a position to use our credibility and influence. We can no longer shy away from these conversations. We are the experts. We have our nation's trust, and we must use our voice to act on climate change.
I'm convinced. So that was a great, yeah, love that. And I think it's important also, like you said, who's in the elevator with you. I think, starting with people, knowing your audience, and start with people, stay with people is the first piece of advice in ecoAmerica's own communications guidance on talking about climate and health. So I think that was a really insightful point. And you may have up to, 3 to 5 elevator pitches in your back pocket, depending on who you're with. So I want to wrap us up. I have a final question for you both, which is that in this country, your zip code determines your life expectancy, and climate change is exacerbating these health disparities. The same pollution that worsens air quality and accelerates climate change also directly harms our lungs and makes us more susceptible to COVID-19 and respiratory infections. To close out, I would like to invite each of you to share your thoughts on climate actions as health equity solutions. Why don't we start with Gloria?
Thank you. Look, we all know that the science is clear. Climate change is the most serious threat right now to public health, to human health. And as nurses, again, we have a duty to provide our patients, our communities, families, children with just a safe and healthy future. So I would challenge each nurse right now listening to join the Nurses Drawdown movement by taking a personal and a professional action in 5 key areas, those being energy, food, nature, mobility, and gender equity. So for example, I took the challenge to limit my red meat intake to only twice a week. It may seem like a small part, but I think that it has a big return and a big impact if we all just do our part. So to learn more, I would encourage anyone, again, listening to please check out nursesdrawdown.org.
We have a very awful track record in this world as well as in this country. No matter what the environmental health threat is, if one is poor, if one is of a minority, racial, or ethnic group in whatever society one is living in, they have more exposure to environmental health threats and worse outcomes from those exposures. So where all the petrochemical factories are in Texas and Louisiana, that's where poor people and minority people live. And it's no different with climate change. Climate change impacts low-resourced communities, communities of color, in much more devastating ways than other communities. They don't have the resources to do some of the adaptation and mitigation that's required at a local and regional level that a more well-to-do population, county, city, state, or nation would be able to do. And so we have to incorporate concepts of climate justice in every climate activity that we undertake. The coronavirus pandemic has shown us in this country, unfortunately, that we don't have a strong public health system, and many of our safety net systems don't work very well either. As climate change progresses, if we do not do the adaptation and mitigation that are required, those weaknesses in the public health system and in the safety net systems will only become more obvious. There will be more people impacted. Those people will be impacted more severely, and we will have much worse problems that we have to deal with as we're trying to deal with climate change going forward. So now is the time to act. Every health professional in this country can turn to organizations like the Medical Society Consortium, like the Alliance for Nurses for a Healthy Environment, ANNI, like ecoAmerica. There's useful information in all of those places for how health professionals can become involved, what health professionals can do, whether it's in their own homes, whether it's in their practices, whether it's in their clinics, whether it's in their hospitals, whether it's in their county, city, state, or nation. Whatever scale they're comfortable working with, there's information in those websites to help people take the actions that are necessary to protect the environment and to protect human health.
Yeah, wonderful. And you've both have provided such concrete examples, and you've done them yourselves. And so I think that really helps people understand and understand that it's possible. And Jerry, the one area that you didn't explicitly mention that people can get involved is with their professional association. And I know that both of you have. So I would just add that in as another level where people can get engaged. And move if your professional association hasn't signed on to the call to action, for example, they can. If your professional organization hasn't, doesn't have a climate statement, they can write one. And you've both been really engaged in your own professional associations. And so I just wanted to explicitly name that, particularly for, health professionals who may be really involved in their association, but maybe don't realize they don't have a climate statement yet. Could be a great way to stay engaged.
Thanks, yes.
Mm-hmm. Yeah, so
yeah, to add to that, Rebecca, I did want to just share that initially the National Association of School Nurses, my professional organization, was not part of the climate health collaboration. And I did encourage that that collaborative, and it happened. So I would just use my example. Anyone listening that maybe they're feeling discouraged if their organization has not signed on yet, make that first step. Email the board, email the president, and just facilitate that conversation, because they are open to it. It's just that right now our focus is on other things. But just take that first step.
Great. And we'll be posting a blog to accompany this recording when folks watch. So if you look below, if you're watching on YouTube, you can see there's a link to a blog which has a whole bunch of resources that we've mentioned. If you're curious about links and ways to get engaged, we'll have all those links available for you, including the Nursing Collaborative on Climate Change and Health that Gloria just mentioned. We've done a partnership video with the AAP, and we just did a recent webinar with them to celebrate Earth Day. So we'll have links to all of those resources available for you. So just thank you so much, Jerry and Gloria, for spending time with me today to share your wisdom and concrete actions. And I want to encourage everybody listening to follow through on your advice to speak about, act on, and advocate for climate solutions as a health imperative. Please join us on Thursdays for new live episodes. Engage with us online using the hashtag Let's Talk Climate. And be sure to subscribe and follow us on our social channels for the latest thought leadership, resources, and episodes on climate action and advocacy. From all of us at ecoAmerica and Climate for Health, thank you. Please join me in caring for our climate in order to care for our health. Stay well, stay safe, and get active.